Now will be just to verify everything that we have already seen in the written communication with Dr. Bertagliani, because we have you here for the first time.
Right.
So I'm asking you a lot of questions now which we already have answered, just to make sure that we didn't miss anything.
Okay.
Okay? It's always good to pretend to know nothing. Okay. Fine. So, for how long do you have neck pain? That's why you present to here.
Started bad in February of last year,
Mm-hmm.
so about 11 months. I've had it on and off since the late 80s.
Okay? Yeah. But in February it got really bad from one day to the other?
Yeah, in February I started having shoulder pain
Mm-hmm.
and difficulty lifting it, and went for physical therapy.
Yeah.
And found it just wasn't getting better. Thought I had a slap injury in the shoulder.
Mm-hmm.
During PT, I ended up straining my neck by doing some traction.
Okay.
And from that point on, pain down the arm, which progressed to numbness in the right hand and some trouble walking intermittently.
But it was only on the right side, or do you ever have pain in the left arm as well?
Pain is constant in the left arm, and left shoulder mainly, but it goes down the left arm. The right one was intermittent.
Okay. How far down does it go? To the elbow, to the wrist, to the fingers?
Left side, continuous pain in the shoulder constantly. Sometimes I'll go down to the elbow. Right side is intermittent, but it goes down to the hands. And it's more dexterity I've lost, like suturing, holding things is where I have the difficulty with.
Okay. Do you have any numbness?
Not true numbness, more of loss of spatial awareness.
Okay. In all the fingers, or is one finger more than the other?
I'm gonna guess it's a longer, but is what it seems like. But I didn't pay enough that close attention all the time.
So it's not just one stretch to the middle finger; it's just the whole arm. When you tell me you're having a walking, we've realized that your walking is different, or that you have numbness in the feet, because that's something which is becomes very important when you talk of cervical prolapses, whether the myelin is affected, or just the radiuses to the arm. Since when do you realize something in your legs?
I want to say October, November is when I started getting bad. And basically what happens is I just trip over my right foot.
Okay.
Don't fall, but I stumble.
Yeah.
And you know, that's pretty much where the difference was. Intermittent, doesn't happen very often, but I have noticed it. And it hasn't happened probably for the past 2 months.
Okay. So it's not really progressive, but it's there. You do not have back pain with the low back pain?
No.
No. Not at all. It's something different. Fine. Okay. Well, I have to ask you that. Do you have any change in passing your urine or containing your stools?
No problems with that.
No. Fine. Great.
Yeah.
So, what sort of therapy did you have for your neck and arm pain? You mentioned physiotherapy, which didn't help.
Yeah, I started out thinking it was a shoulder injury, got the MRI, and was doing range of motion and strengthening exercises for the shoulder. And they would only last a day and come back.
You had physiotherapy and they strengthened the muscles, but it didn't do much. Did you have any kind of steroid injections to your vertebrae or to your nerve root outlets?
Not in 2-3 years at most. I've had them before.
You had them before, for the neck pain issue?
For the neck pain. I've done cassette blocks, I've done an epidural.
Yeah, with temporary relief.
Yeah, each time it lasted a little longer.
Okay. What medication are you on for your pain problem?
Right now I'm doing Lortab, pretty much at 5 milligrams, probably about 3 times a day now.
Sorry for asking you that. I can't.
Oh, hydrocodone.
Okay, thank you so much.
Yeah.
Okay, generics or international brand names are not.
Right.
Okay, fine. That all corresponds very well to the distant generation that you know, and that's why you came to us, and which Dr. Bertagliani wants to or suggests to address with ADR. Of course, the clinical findings have to correspond. So may I ask you to get undressed so I can examine you?
Certainly.
Please? Slip can stay, all the rest has to go.
Okay.
The standard pain medication post-operative will be something like a naproxen and a muscle relaxant and an opioid lysohydrocodone as needed for pain. If we see that somebody needs strong medication, then our standard is oxycodone, which you will know. Okay, but the important thing is that after surgery you decide whether your pain medication is okay. Please feel free to tell us. Pain medication is there to kill pain, and you're going to tell us what your individual need is. That's very different from patient to patient, as you know.
Important to control.
Okay, I had to ask you on allergies. Are there any known allergies against drugs?
No allergies to drugs or contrast.
Right. Especially contrast media we're going to use in surgery if we can, so we can in you, and we're going to use a single shot prophylactic antibiotic, which is cephalosporin. If you don't have any allergies, we can use that. Okay, so the anesthesiologist doctor will check on you for his purposes, but well, in your case there's nothing special to expect. After all, it's medium invasive surgery with a short OR time, so probably after surgery you can go to the recovery room for an hour or so and then go back to your ward.
Excellent.
From my side, no questions open. Everything corresponds very well to what we have found out in biocommunication, and well, Dr. Vandanioli will certainly check on you as well afterwards to explain you how he will do the surgery. He's going to be the surgeon. I will be in your surgery and assisting him probably. Tomorrow, any more questions that you have?
Yeah, answered it great.
Okay, so thank you so much. I'm going to show you where the anesthesiologist will check up on you and our nurse will draw blood, but let's go over to the ward for that, huh?
Okay, great. Thank you.